if you have questions, you want to chat, feel free to do that, and we'll try and take questions toward the end. And just as a reminder, this is being recorded, and our hopes that you will share this after the webinar. We did this pretty quickly and started notifying people only a day ago, so I'm sure a lot of people may not have been able to attend it based on that. So, oops, sorry. So I'm Carolyn Bradfield. I'm the CEO of Pathroot Health, and I'm joined by Bruce Ahern, also of Pathroot Health. We're certainly not experts on the Rural Health Transformation Program, but having said that, we've had a lot of touches with the states over the last 3 weeks. So Bruce will explain that in a minute. But I think we have a good kind of command of what the states are focused on, how the federal government looks at this, and how to advocate if you want to influence these guys. So what we're going to focus on today is, for those of you that don't know what rural health transformation is, we're going to define what it is, how it got started, and all about the timeline that it takes to get it in there. We're going to help you understand what the federal government finds as important and what their priorities are. And that's super important because as the states are deciding how to fill out their applications and what they're going to focus on, knowing who's going to evaluate those applications is going to be mission critical. So we're going to go through the application process and how that's working. And then what are the rules? I mean, you know, this is one of these deals where they've laid out very strict guidelines in what the states can and can't do, how to apply, and how they're going to evaluate. And then, you know, our interest in particular, the reason that we started focusing on this is we have a particular focus on behavioral health and addiction. That was actually called out as one of the federal priorities. So we just wanted to make sure that the states didn't forget that, and that they had what they needed to focus on that. So Bruce, do you want to say anything specific about, you know, what we're going to cover today and why we're doing it, how many people we've talked to?
Well, we've been sitting on the sidelines listening to a lot of what the states are discussing and how they're piecing it together and how they're interpreting it. And there's a lot of things that they're doing that we feel probably they're going to fail on, because they're getting away from the core values of the reasons that this program was implemented. And this all came out of the Rural Health Transformation Program is truly designed to be transformative of how rural health is dealt with over the next 5 to 10 years. And the objectives, this all came out of the One Big Beautiful Bill, and the objectives of it haven't changed much in the way that this administration has been looking at healthcare and behavioral health in the current administration and in the previous Trump administration.
Yeah, and it's not just behavioral health. It's like, how do they look at chronic disease? How do they look at, you know, a number of things that we're going to highlight? But I was on a webinar yesterday and about this same topic, and somebody asked the question, is this political? And while it's not necessarily political, the tagline of this program is Make Rural America Healthy Again. So you can see that obviously there are people's fingers on this. And the other thing also too is that this is a massively big amount of money transferred from centralized government down to the states. And we'll talk about the why behind that in a minute. So I think everybody knows about the Big Beautiful Bill. Very few people know about this transformation program. So this is actually important to me because I grew up in rural Georgia, West Georgia, LaGrange. I live in Salem, South Carolina today, which nobody knows where it is. It takes us 15 minutes just to get to the grocery store. I have had a business in North Carolina, So I've touched a lot of rural communities, and these are some interesting statistics that I pulled out as to, why this is important. We're impacting 60 million people that live in rural America. And statistically, there are 5, high priority chronic diseases that rural Americans are more likely to die from than the people that live in urban environments. 75% of people that live in rural America are in healthcare deserts. They're facing shortages of dentists, primary care providers, mental health providers. I probably should have added maternity providers, given the fact that a lot of rural hospitals are disappearing and they don't really have a place to go for treatment. And rural residents tend to be older. They smoke more. They tend to be heavier, have problems with high blood pressure. They're more likely to live in poverty, and they're less likely to be insured. So all those little things combined together, create a very strong problem that this money is designed to help. So, Bruce, why don't you talk about how this money is being spent? Now, we're talking about $50 billion, and half of it is in one bucket called baseline, half of it is another bucket called workload. Explain exactly what that means.
Well, the baseline is if you are a state, you apply for it properly, you fill out the forms properly, and you address most of the issues, your state should be able to get $200 million a year for the next 5 years.
No, 100 million for the next 5 years.
100, excuse me,
Yeah.
$100 million for a year for the next 5 years.
Correct.
However, that money is, quote, distributed evenly. There are a lot of states that have already bowed out and said they're not going to file. So that pool of money will actually be slightly larger. Then the workload, this is a merit solution. This is applying for it with a significant application that addresses issues that we'll bring up later that are important to what the initiative wants to achieve. And the whole goal of this, it comes down to the federal government wants to enable states to better care for their people, not just for the next 5 years, but for a sustainable period thereafter. So a lot of the initiatives people are bringing up are very short term. They're not sustainable. They require capital expenditures, and all of these things aren't covered by the award. And this is a grant to the states to improve care, the infrastructure for care moving forward.
Yeah, and I think there are probably people on the call, Bruce, that have experience with grants and applying for grants. And generally, it's a pretty lengthy time frame to do it. There's a lot of hoops you have to jump through to do it. But this is incredibly unusual because of its timeline, and it really is a competition between the states. So this is what shocked us. We've only been engaged with this for 3 weeks, but let's look and see how long the states have been engaged with it and how the funding is going to flow down. So Bruce, walk us through the timeline.
Well, the One Big Beautiful Bill was passed in July, and on the 15th of September, an official announcement came out from Medicaid, CMS, announcing all of the parameters for it. A lot of the states have been following it, but not all of them. And we sat in on a state webinar or a federal webinar talking about how all of this comes down and how it's being applied. Now, we have less than 30 days between now and the applications having to be submitted to CMS by midnight on the 5th. And by New Year's Eve, Everyone will be notified what they're going to get out of this solution. And then all heck breaks loose January 1st when it starts, and the money's going to start flowing down to the states.
Yeah, so just so you'll know, from a process perspective, the states opened up a request for information period that was extremely short. We actually filled out probably over 30 requests for information from our perspective, like here's our idea, here's what we think you should focus on. But getting all these constituents to go fill out information and then try and make sense of it and write it into an application is a really daunting task. I'd like to do a shout out to the state of Colorado. They actually hired a consulting organization to help. They had a really powerful work group. We were on with Indiana yesterday. We've done Ohio. I don't know what else.
New Jersey,
Illinois. I mean, so we've been on all these webinars. So we kind of get a sense of where the states are focusing, what they're doing. But look how short the time frame is. Like right now, some states are still taking input from their communities. Some states have cut that off. But they've got a really short period of time to write that application. And I'll explain, in a minute, why that's
what really sits in the back of my mind is, so you've got from November 15th to January 1st, December 31st, 55 some odd days with 2 holidays in the middle. And how in the government are they going to gauge, value, score 50 or 49 state applications against what? And then come up with a magic number that they all receive. And that money they receive for the next 5 years, they have basically about 5 3/4 years to spend it. And they have to spend it within each given fiscal year structure with the federal government. And so there's talk about a lot of moving parts that I'm not sure how they're going to bring it together.
Yeah, I think every state's got, their own plan and process to do it. And I think it's really, an incredibly heavy burden to put on the states. But, this is one of the reasons that we're doing the call today is to, share with you what your state is doing. But then we're also going to talk about how you can help your state. And you'll see that it's really clear in a minute. So this is a competition. So we've already acknowledged that 500 million is going to be split evenly between the states, no matter how large or small you are. You're going to get 500 million. We always use the term, if you can fog a mirror and you have the governor sign the deal, you're going to get half that money. The rest of it, the other $500 million is up for grabs. And I'll explain how the states are going to, or how the federal government's going to make that decision. But these are the 5 priorities that the federal government has issued that they care about. I've already said make rural health, America healthy again. They care about prevention. They care about the management and prevention of chronic diseases. And they didn't call out cardiac disease, diabetes, or kidney disease. They called out 2 that they really cared about. One is the lane we swim in, which is behavioral health, and the other is prenatal care. What they want to do is, when you see sustained access, what they want is more efficient way to reduce costs so that they can sustain these initiatives when the grant money runs out. Workforce shortages are very acute in rural America. Most people don't want to move to Hogansville, Georgia, or to Salem, South Carolina. So attracting and retaining workers is a critical issue that they want to focus on, and then train them up. There were some pretty creative ideas about how to do that. And then take a healthcare worker and maybe he's siloed into one role. They want to be able to broaden that out. And one, I think this came out of Colorado and actually several other states, that apparently pharmacists are a pretty active group, and you've got a CVS, a Walgreens on every corner. Could these pharmacists do more? Could we broaden their role? They want innovative ideas. Are there new ways to provide care? Are there new ways to tie payment to the care that you deliver? There's a term floating around the industry called value-based care. So if you measure your outcomes and you do better than the next guy, then that should provide you the ability to get more reimbursement. And then they want to incentivize affordable, accountable care organizations to do better. Technology is mentioned all over the place. It's everywhere. And so they want technology to facilitate better delivery of care. They want people to collect data, but also secure it. So they want a really strong focus on cybersecurity. Digital health was mentioned quite a bit. You may know that as telehealth, remote patient monitoring, but digital health was right up there. And then they want you to think about emerging technologies. And the biggest one that I can call out is artificial intelligence, which has the power to really transform how you intake a patient, how you do these mundane tasks like writing up your clinical notes. It can be utilized in working directly with patients and the community to answer questions. But these are the things that the government cares deeply about. Now, the other thing that they called out is, what categories can you actually deploy to use these funds? You don't have to pick all 11 of them. But you have to pick at least 3. So again, another call out to Colorado. They decided on 4. Their governor evaluated all this. They looked at 4. So, if you look around the thing, and then you go back, I'm going to go back one slide to what they care about. Chronic disease and prevention is a huge thing. I would say that if you're not putting that in your priorities, you're missing a big priority. The workforce is a huge thing, and then in technology and innovation is huge. So Bruce, you sat in more webinars than I have. Let's look at what is common among the states. What are we hearing when we go to these webinars?
The ones that I would expect to hear, I don't hear. People aren't talking about behavioral health necessarily, which surprises me because it has so many permutations. And if they look at the current scope of the way the government is approaching healthcare, one of the big things they look at is the opioid crisis, addiction, how all of this falls into place in criminal justice and extended healthcare requirements. But in the states, dentistry comes up very often, and I can understand that. I also can understand that in a 5-year time window, training more dentists and deploying them is not exactly something that's very achievable. Innovation and technology, people gloss over it, but as you said about AI, technology is a force multiplier. It allows you to take and use what you've got and make it more powerful. Remote patient monitoring, that's an industry I've been in for decades. I think that's going to be very important. And, in a remote environment, some of the issues that come up are availability of Wi-Fi. And I tend to believe it's not as big a problem today as it has been in the past. And mobile applications, using that for understanding patient response, I think is going to be very important. People talk about how can you attract individuals to go to a rural environment and practice. And I was talking with my very close friend who's a surgeon, and his comment was, after spending, 20 years in school to become a surgeon, then to deploy to a rural market to be paid a fraction of what I could make in another industry. I'm sorry, I don't know that I could do that.
Yeah, I think all of those are common themes. I was actually a bit surprised. We listened in, I think it was Indiana yesterday, and they revealed the survey that several thousand of their citizens responded to, and the number one thing that they wanted people to include is better nutrition, access to better food. So that tells me that the call that I was on yesterday, food as medicine, has a lot of legs if they can find a way to tie it to technology and sustainability. But these are the themes that we keep hearing: workforce, chronic disease, prevention, management, and innovation. And there's two things that the federal government is asking a state to change their policy on if they haven't already. They want you to reinstate the president's physical fitness tests in schools. It may be a thing that people are doing today, but they want to make sure that people are physically fit. And then the other one was change your policy on SNAP programs, which gives you food, and don't let people buy potato chips and cigarettes with it. So that just tells you, kind of where their head is. Now, let's talk about how things are scored. So I'm now talking about workload. This is the extra $500 million that a state can get. And so half of that money is going to be things that the state has zero control over. How big are you? How many people live in rural communities? How many people don't have insurance? How frontier is the state? What that means is, how far do you have to drive to go get somewhere? Like if you take Arkansas, was one that was called out. There's a lot of distance that you have to go to actually get to a hospital. And then, what percentage of hospitals are receiving Medicaid reimbursement? Now, the interesting thing is those numbers are set the first year, and no matter whether your state shrinks or grows, is irrelevant. It's set for the next 5 years. So again, this is something that the state has no control over. It's just a number. So you can probably expect, just guessing, North Carolina is in a pole position, because a study that I think it was done by UNC showed how, which states are the most rural. And North Carolina was, like, I think, right at the top, along with Alabama, Georgia, Arkansas. At the bottom are states that you would expect. Delaware, New Hampshire, smaller states that, that have less square territory. But then the other half is what they call technical. So how are you going to be scored on that? And the three things that come to the front are, is it initiative based, meaning you're going to do something as a program, you're going to execute it, and we'll give you a few examples of those. Will you change your policy on things like the SNAP program? Will you change it? And then some of the other stuff is just data driven, just metrics that are out there that they're going to be looking at. So we created this is only half of it. I'll show you the other half in a minute. We created the areas that get the most or the least points for doing it. And so I stands for initiatives, S stands for change your state policy, and D stands for, hey, we're just going to look at the data. Anything that's in the darker blue gets double the point value of the things in the lighter view. And you can see that it's all very initiative focused. So I've already talked about preventative care, healthy lifestyles, tobacco, obesity, etc. One thing that's also very clear is that they want states to start taking their rural providers and have them collaborate with each other, so exchange ideas, use common resources, but not try and reinvent the wheel. So as I said before, I grew up in rural Georgia, West Georgia, LaGrange, and we didn't have the ability to go get a cardiac cath done. We didn't have very many OBGYNs. So that would be a good example of, can these communities pull together and maybe have a regional focus with some of these specialized things. Emergency medical is called out. You strengthen those people because they're right there. Recruit the workforce. How can you recruit the workforce? I saw some things like tuition reimbursement, but what can you do to get these folks in here? I would tell you technology would be one on top of my list, because you can't get a 25-year-old, behavioral health or nursing graduate that is used to artificial intelligence, ChatGPT, TikTok, and whatever, and throw them in a healthcare environment with technology that was developed in the Stone Age. So that makes it a little bit different. And then again, value-based care is in here. Can you track your outcomes? Can you improve the care quality? And will that help you with higher payer reimbursements? And let's think about Medicaid for a second. There's been signaling at some point that CMS is going to change their guidance and focus much more on value-based care than just fee-for-service. They call out remote care services, telehealth, remote patient monitoring, virtual care, do things online. And then they want you to invest in technology, be able to exchange data, be able to look at your outcomes, be able to report things. That's going to be also very important when it comes to sending information back to the state. And then consumer-facing technology, patients, families, education, raise awareness, prevention, etc. Help these people by giving them something that they can log into and get information that they need. So, what's the key to be successful? The initiatives carry the most point value. And initiatives have to have 5 different things in there. What's your strategy? How are you going to deliver it and monitor it? What outcome are you looking at? What's the overall impact? And sustainability is super, super important. What this means is when that money runs out, are the programs going to disappear? So how can you sustain it? Bruce, do you want to add to that? And
yeah, that was a point when we listened to the to CMS explaining this program. They stopped on that point and were very clear that and this is I've worked in government systems for many, many years, and it's not unusual. It's like, okay, the program ran out, everything stopped. We roll up the carpets and everyone goes home. Well, you can't have that happen in this environment, especially in a rural environment, that you start and you have to be able to sustain beyond the 5-year mark on this money. Will there be more eventually? Who knows? But this is a big transformation that has been dictated down to the states, or at least gifted down to the states, so that they have the ability to make some fundamental changes in the way they're approaching healthcare to a huge population.
Yeah, and also too, on that last little bullet, you're going to get, you won't get deducted, but there's some like easy points a state can earn just by changing their policy. It's a SNAP program, and there's I listed all these out, the things that have an S next to it. That's the state policy that somebody needs to focus on. So we've been on, like I said, almost 10 webinars, and we listen. We sometimes we comment. It's very rare that we'll do that, but in a few cases we'll comment. But here's a set of ideas that all are valid. They're interesting, they're helpful, make a difference. But they're missing some things that will score them lower. So add more people to go visit people in their home. Good idea, but is it sustainable? Because you already have a shortage of workers in rural America. So that's a problem. And how do you fund it past the grant period? Provide transportation support. Still a very good idea, but for this particular grant, probably not sustainable. I saw one, deploy medical supply vending machines. Well, that's capital intensive, hard to manage. You know, interesting, but does it meet the criteria that we saw before? Probably not. Distribute unopened medicine for people to use medicine that was prescribed to somebody that they didn't use it. So we're going to go distribute it and put together repositories where this is. That probably has a lot of health implications. So these are some of the ideas that consultants like in the state of Colorado or the work groups like in Ohio are going to have to sift through and see if it meets the filter. And then here's some that have the potential to meet the filter. Enable the workforce with AI technology like managing intakes, managing administrative functionality, answering questions for the community. That's what they're looking for. You already saw family being called out, like we need consumer technology, so let's take, and we need people that, we need to help people manage chronic care conditions. And I'll give you an example from my own personal life. I was a medical surrogate for an older gentleman that had chronic kidney disease and was on dialysis. Well, that was very confusing to me because it required understanding dialysis, understanding his diet. It was emotionally draining. So if you could put together virtual communities of families going through the same thing for education and support, that checks several boxes. Remote patient monitoring, we've already talked about that. The use of wearables, everyday Fitbits, Apple Watches, whatever, to go collect data, run it through algorithms and assess problems so that you can get to them proactively. And then they really, really want these regional providers to communicate with each other, share data. Well, you got to build a system to do that. So those things tend to be things that would meet the criteria. So here's some things that you need to know that I think are important. I've seen these questions asked on webinars. So CMS is going to evaluate the initiatives every year. And if you don't have the data to show your outcomes, if you're falling behind on the initiatives, they might take money away from you and redistribute it to other states. So that's called a clawback. And also, if you don't spend the money, they want you to spend it in the year that they designate it. There's no rollover. It's not like, I spent $150 million. I have 50 million left. I'll just roll it to the next year. That's a big no-no. They'll take it.
Well, actually, so it's a little longer than that, but not much. So you're in 2026, you're awarded the money on January 1st, and you have until the end of federal fiscal, which is, I guess, September 30th in 2027 to spend it. So it has, you've got a year and not quite 3/4 to spend the money. However, if you've ever been in the federal environment, that at the end of the federal fiscal budget, people are sitting there trying, how do we spend this money that we were allocated, because it's going away. And that's the way the federal government works.
Bruce, I think I'd like to make one adjustment to what you said. I think that longer time frame is most specific to the first funding period, but then the rest of it, you don't have 18 months in every period. It's going to end in fiscal year 31 or 32. But
no, I'm pretty sure it'll go to the end of
32.
Yeah, to the end of the fiscal period.
Yeah, the other thing to know is that whatever you put in there's one application, one, and whatever you put in there is what they're going to hold you accountable to for 5 years. So if all of a sudden you come up with a new idea in year 2 that's not on your application and not on the list, don't even think about it, because they're not going to allow it. That's why this period of supporting your state, helping them craft that application, throwing, good ideas at them, is so critical, because otherwise, they think about it after November, it's not going to happen. I've had people ask, well, I'm a technology provider, can I apply? The answer is no. Only the state can apply, and they can apply through a lead agency. So the governor signs the application. He authorizes some agency within the state, might be rural health, it might be CMS, to be the lead to go manage all this stuff, but they're the only ones that can do it. Now, does that mean people that are technology providers, education providers, food as medicine providers, are they shut out? Absolutely not, because the state can contract with these people, consultants, tech, et cetera, to deliver the initiatives, but the state has to do that, to contract.
The state is going to have to contract with
right
groups to deliver and integrate these entities, and then they're going to have to coordinate with their own rural communities, county groups, in order to deliver and monitor the output and monitor the people at the end of the care delivery.
Yeah, so they're going to be, like on November 6th. Right now, they have more to say grace over just to get the application out the door. But I bet you on November the 6th, they're going to start like, who can help me do these things, right? And if you're already in the mix of providing assistance to them, with your idea, you might be first in line to get it. And then it must be data driven. Don't put anything in the application you can't measure. You have to know that they're looking at outcomes, and they're very, very, very data driven. So those are the things that, we hear ask a lot, and that's our answer to it. All right. So yesterday was the time to act. And my recommendation and our recommendation is to get in touch with your state and their work group, the people that are working on this. Don't surface ideas that will not meet the criteria. Focus on ideas that are innovative, that are initiative driven, that are tech driven, that are forward thinking. They'll get scored higher on that, and that are sustainable. And then if you really want to, go all out, which is what we did, provide each state with not what you do as a vendor, but something that's vendor agnostic, drop-in language for their application, and let them decide if they want to use it, but at least give them a toolkit if they want to use the language. There's only 60 pages that are allowed in the narrative for the state for all these little initiatives or big ones. And so when we did it, we made ours 4 pages, and they could cut that down. But what they want to know is, what's your idea? What's the overview? What outcomes are you trying to measure? How are you going to execute it? And how much is it going to cost? Those are kind of like the basics.
Well, and then I would go back and look at the dropout factors that are very clear in this, the NOFO, which is the NOFO, they call it, the notice of funding. And it's like no capital expenditures. The states can spend no more than 10% of this on administration.
Yeah, and again, if you can't measure it and you can't sustain it past the grant period, that you're going to get, you won't earn the points. We want to help you, and like I said, we've been in touch with every single state. We've been on these webinars. So what we can do for you, if you choose to take our help, is give you access to who in your state you should be talking to. We know who these people are. We sent every single state a 1-page overview of why they ought to focus on behavioral health, what's what outcomes should you be looking at, how to do it. It's quick, it's easy. Then when we went beyond that and we gave them the sample application language, we'll also give you links to each state so you can see what they're doing. There's still 1 or 2 states that are still yet to hold their webinars. I think there's maybe 1 or 2 next week. A lot of them have told you that their time to collect information is past. Don't let that stop you. You know, send an email. They're all still taking input. So maybe their form to fill out the general information is closed up. But that doesn't mean you can't send an email.
But you have to put yourself in their position. You know, they have literally 1 million people that are in their state that are looking at them for help, and everyone has a different idea. So what you need to do is provide a solution that fits the guidelines, makes logical sense, it's measurable, as Carolyn keeps saying, and follows and gives them something that they can become heroes by dropping this into their proposal. And you also have to look ahead. You know, we're looking 5 years from now when this ends. It's like, how does all of this play for the next 5 years?
Yeah, so look, again, we're going to provide you the slide deck that we're doing, all these things. We'll put it on our website. And for those of you that registered on Pathroot Health and signed up, we have your email so we can correspond with you. If you're listening on LinkedIn and we don't have your email, here's ours: Carolyn@pathroot.com, Bruce@pathroot.com. Write us and we will give you a link to where we're posting all that stuff. And please do not hesitate to share that link with others. We want, anybody that can be helpful to know and understand that.
Yeah.
So that's the end of what we wanted to showcase and talk about.
We've got a question from Donnie Hagenbart. So do we know which states have bowed out of the grant?
The answer is maybe. Princeton University created an interactive map that you can click on each state and you can see what they're up to. And I would say, Bruce said earlier that a lot of states have said no. That's actually not the case. We think maybe Delaware said no because on that interactive map, it shows no activity. They may have bowed out. But I think the rest of the states, most all of them are in play. So Delaware is the only one that I have questioned. All right, so Brent or Bruce, are there any other things, since I'm presenting, I can't see the chat, any other questions that?
I don't either, Brent.
So Brent, if you'll open up your microphone, if there are any things that we need to answer, that would be great.
No other questions at the moment.
Okay, awesome. Well, good. Well, maybe we answered the questions. And again, we're not experts in this, but we've spent a lot of time trying to learn it. And hopefully this was useful and helpful to you guys. So good luck. Let's take action and let's get our ideas and priorities best represented. So Brent, you can go ahead and end the meeting at this time.